so that I can actually record this and people can review it. Okay, so again, we're trying to take a look at a broad picture view of what we've learned over the last couple of months so I can get an intro for all these new people and review for the ones who have been through this. So some objectives from here. We're trying to talk about, in this section here, we're going to talk about how we measure radiation, okay? Because some of us may know that we have devices to measure radiation, right? Whether it's radiation to the personnel, the X-ray technician, right? We have things like a dosimetry badge that we wear. We can measure radiation with electronic detectors, right? And so we need to understand the units that we use to measure radiation, right? You know about units, for things like you talk about units of distance, right? There's things like the kilometer, the mile, the meter, and the foot, right? Those are units of distance. We have talked about, and we're reviewing today, the units that we use to express radiation, okay? Units that express exposure to radiation, units that express radiation dose. Some of you should be going in your heads who have heard this already, should be going, yeah, those are different things, right? And units to express what's called equivalent dose, which talks about, you can be exposed to a type of radiation versus another type of radiation, and they might affect you differently, okay? We want to be able to discuss the potential effect of radiation injury to the body. What does radiation do? So maybe I should ask my new people, if I really want to hear from you, one of you five. When I say, or when somebody says radiation, what comes to mind? What words come to mind? Like super good for the body? No, okay, so some words come to mind, right? What did you have?
Waves or something?
Waves, okay. I like that. I like waves, okay. What else?
Isotopes.
Yeah. So you're thinking particle radiation, right? Good, absolutely. Anything else?
Cancer?
Cancer? Absolutely, right? Okay, so,
Annual visits.
yeah, definitely. So, does my desk get cancer? No, right? Who gets cancer? Or what gets cancer?
People.
Living things get cancer, right? Biologic organisms can have damage from can get damaged from radiation, right? My desk doesn't get damaged because it's an inanimate object and it doesn't change over time, right? Cells, living cells, can be damaged because they change over time. Okay, we're going to review some ideas behind that. So, radiation can injure things, living things, and we want to be able to talk about that. Okay, so what things can happen? We want to be able to define and compare. By the way, I'm on wireless to the TV. Sometimes it cuts off and I can't see it if I'm looking this way. So make sure you guys tell me. A lot of times it'll happen and then no one will say anything for a few minutes. They'll be like, hey, we can't see anything. Anyway, so if that happens, please tell me. So we want to be able to define and compare radiation risks according to the type of radiation. According to the type of risk, right? So, okay, so they list words here like somatic and genetic, short-term versus long-term. Everyone else who's not brand new today should have an idea of what those words mean. So when we say somatic damage or somatic risk, what are we saying? Gladys, what are we saying when we say somatic risk, somatic damage?
Somatic's more like damage to the person himself, could happen days, weeks.
Yeah.
And genetics, more of down the line.
Yeah. So if there's a genetic effect, so an organism, a person is irradiated, right? Some amount of radiation, and damage happens to, let's say, their gonads, right? Their sex cells. When we say genetic effects, who's affected? The person who's irradiated or their offspring? Their offspring, right? That's what we mean by genetic effects. Somatic effects are those effects, as you correctly said, which happen to the person, okay? Somatic effects happen to someone, right? You have to be someone to have a somatic effect happen to you, okay? I'm emphasizing the some part of that, which some means body. These effects to the body or to the genetics that produce offspring can be short-term or long-term effects. Most of the time, as you correctly said again, somatic effects, effects happening to the body from radiation, are typically short term. Those seen in days, minutes, weeks, or hours, I was in no particular order, when the dose is very, very high. Okay, short term when the dose is very, very high, right? And effects can be long-term effects, those seen years afterward, at least several months to years, when the dose levels are very, very low, such as those that we see in the X-ray room. Okay, so to be clear, in a radiography room, in a traditional radiography room, so not in cardiac catheterization, not in fluoroscopy, which is video X-ray, not in CT, but in a traditional X-ray room like we practice for. The radiation doses we actually use are so low, we're going to talk about them today, they are so low that they cannot cause short-term effects. They can't hurt the body so bad that things happen right now, right? They can only cause long-term effects, okay, those that happen years, months or years after exposure. We want to be able to discuss the risks of exposure to low doses of ionizing radiation and compare these with other familiar health risks. We talked about that one last time in the last class when we discussed, like, when we did this lecture last class talking about risks compared to radiation. We talked about like job risks and we talked about like lifestyle risks, right? What was the riskiest thing you could do or be? You guys remember it? Male and unmarried, right? So when they talked about loss of life, right, shortening of lifespan, right? Radiation exposure does not significantly affect things like lifespan, right? Compared with all of the other risks that we undertake, right? Getting in a car, smoking a cigarette, drinking some alcohol, being a male and being unmarried, right? That has a potential shortening of lifespan of up to 10 years, just being male and staying unmarried. Whereas if you are not male or are married, your lifespan can, on average, is longer, right? Now this data is taken from, 30, 40, 50 years ago, right? But still data, right? Okay, so there are health risks. We want to know how radiation compares to these other health risks. We want to be able to explain the significance of the principle, the chief principle that we talk about over and over and over again in radiography, which says that whatever amount of radiation we need to use to make the exposure, right, for an image, to create an image, we should use as low of an exposure as reasonably achievable, right? The lowest amount of radiation you need to use to make the image you're trying to make. So your job as a radiographer or an X-ray technician, right, is to make X-ray images, to create radiographs, right? That's the job. Get the job done with the lowest amount of radiation possible. We know that radiation can cause harm, so we want to use as little of it as we can, right? That's the goal. This is a principle called the ALARA principle, as low as reasonably achievable, ALARA. We'll drill that over and over and over again. All right, last set of learning objectives. We want to be able to list and explain the methods for minimizing patient dose during radiography. That's going to be the subject of these first couple of classes. So this review talks about it a little bit. I'll get into the actual chapter material after this, and that will really get into discussing how we can lower patient dose during radiography. And in fact, one of your guys' homework assignments is going to be to take the technique chart for your office, or the school's technique chart if you're not in an office, and modify that so it lowers patient radiation dose. So that everyone knows what I mean, a technique chart is a piece of paper kept in your X-ray room that tells you, if you're shooting this exam, how much radiation should I use, right? What settings should I make on the machine? So it is not just like an automatic camera, it's more like a manual setting on a camera, right? With an automatic camera, like on your phone, you just take a picture, right? Press the button, take a picture. But if you've ever taken photography, you know that there's many settings that your camera has to change, right? The X-ray room works like that. There's many settings that we change, okay? And those are called collectively radiographic technique. Every X-ray department, every X-ray room, facility must have what's called a radiographic technique chart, which says this exam requires this much radiation exactly, so you can set it. Anyways, so your job, one of your guys' jobs is going to be to take a technique chart and modify it so that it lowers radiation dose to your patients, something we're going to talk about today. List and explain the precautions for safety of the operators, right? So not only the patients are important, it is not only the patients who are important, but it's the operators too. You guys, the limited machine operators, right? Radiographers, limited x-ray techs, radiologists, right? Um, we are the ones who are spending the most time around radiation, right? We learned in one of the first radiation safety modules that early on, so X-rays were discovered in 1895 by somebody named Wilhelm Röntgen, okay, November 1895. And from there, within 10, 15 years, people experimenting with radiation began to die and began to live shorter lifespans than they used to. And so they very quickly learned by trial and error that we needed to protect ourselves, the operators, from radiation exposure, right? You didn't know it was harmful until we had people start dying from it. Lastly, list the potential risks of radiation exposure during pregnancy and explain ways to reduce these risks. So those are our learning objectives for today. We're going to try to satisfy that. Okay.